Hey there, today we are going to talk about a condition called osteomyelitis. It's a serious and sometimes life-threatening bone infection that affects thousands of people each year. What is osteomyelitis? Osteomyelitis is a bone infection caused by bacteria, fungi, or other microorganisms. It can occur in any bone in the body, but is most commonly found in the long bones of the arms and legs, the spine, and the pelvis. Osteomyelitis can develop as a result of an open wound or fracture, or bacteria can travel to the bone through the bloodstream. Symptoms of osteomyelitis include fever, pain and tenderness in the affected area, swelling, and redness. Treatment usually involves antibiotics and surgery to remove any infected or dead tissue. If left untreated, osteomyelitis can have serious long-term consequences. Please like and subscribe to our channel and click bell icon to get more health updates. Osteomyelitis causes. Osteomyelitis is usually caused by bacterial infections, but it can also be caused by fungal infections or other microorganisms. The bacteria that cause osteomyelitis can enter the bone through open wounds, fractures, or surgery. In some cases, bacteria can also travel to the bone from other parts of the body through the bloodstream. Factors that increase the risk of developing osteomyelitis include diabetes, weakened immune system, chronic steroid use, and the use of medical devices such as artificial joints or catheters. It's also important to note that certain types of bacteria, such as Staphylococcus aureus, are more commonly associated with osteomyelitis than others. Osteomyelitis symptoms. The symptoms of osteomyelitis can vary depending on the severity and duration of the infection. Some of the most common symptoms of osteomyelitis include pain and tenderness in the affected bone, swelling and redness in the affected area, fever and chills, fatigue and general malaise, limited range of motion in the affected limb or joint, drainage or pus from the affected area, nausea and vomiting in severe cases. It's important to note that some people with osteomyelitis may experience no symptoms at all, especially in the early stages of the infection. However, if you have any of the above symptoms, it's important to seek medical attention right away to prevent complications and ensure the best possible outcome. Osteomyelitis diagnosis. Diagnosing osteomyelitis typically involves a combination of imaging tests, blood tests, and a physical examination. Here are some of the common methods used to diagnose osteomyelitis. Imaging tests. X-rays, CT scans, and MRI scans can be used to identify any changes in bone density or structure that may indicate an infection. Blood tests. A complete blood count (CBC) can help identify any signs of infection, such as an elevated white blood cell count. Blood cultures can also be taken to identify the specific type of bacteria causing the infection. Biopsy. In some cases, a small sample of bone or tissue may be taken and tested in a laboratory to determine the type of bacteria causing the infection. Physical examination. Your doctor will perform a physical exam to assess the affected area for signs of swelling, redness, and tenderness. Osteomyelitis treatment. The treatment of osteomyelitis typically involves a combination of antibiotics and surgery to remove any infected tissue. Here are some of the common methods used to treat osteomyelitis. Antibiotics. Antibiotics are typically the first line of treatment for osteomyelitis. The type of antibiotic prescribed will depend on the type of bacteria causing the infection. Antibiotics are typically given intravenously (IV) for several weeks to ensure that the infection is completely cleared. Surgery. In some cases, surgery may be necessary to remove any infected tissue, drain any abscesses, or restore blood flow to the affected bone. In severe cases, amputation may be necessary to prevent the spread of infection. Pain management. Pain medication may be prescribed to help manage pain associated with osteomyelitis. Wound care. If the osteomyelitis is caused by an open wound, proper wound care is important to prevent further infection and promote healing. Rehabilitation. After treatment, physical therapy or rehabilitation may be necessary to help restore mobility and strength to the affected area. Osteomyelitis prevention. Preventing osteomyelitis involves taking steps to reduce your risk of infection. Here are some ways to prevent osteomyelitis. Practice good hygiene. Regularly washing your hands and keeping wounds clean can help prevent the spread of infection. Treat wounds promptly. Seek medical attention for any open wounds or fractures right away to reduce the risk of infection. Manage chronic conditions. If you have diabetes or other chronic conditions that increase your risk of infection, it's important to manage them effectively. Avoid tobacco and alcohol use. Tobacco and alcohol use can weaken the immune system and increase the risk of infection. Follow medical device instructions. If you have a medical device, such as an artificial joint or catheter, follow the manufacturer's instructions for cleaning and care to prevent infection. Vaccination. Getting vaccinated against certain infections, such as pneumococcal disease or meningococcal disease, can also help prevent osteomyelitis. If you suspect you may have osteomyelitis or have any concerns about your risk of developing the condition, it's important to speak with your doctor. By taking steps to prevent infection, you can reduce your risk of developing osteomyelitis and other serious health problems. Thanks for watching. If you found it helpful, please consider subscribing to our channel and sharing your feedback in the comments section below. Thanks again for your support.